Well, today's July 18. The VA hospital here in Sacramento has never been fuller than it is today. Of course, we just expanded to 71 total beds. Every mental health bed is filled today. Every med-surg bed is filled today. Every TCU bed is full. Every ICU bed is full. And we actually have 6 patients in virtual status. So they're in a physical bed on what used to be the 3rd floor MSU before we moved it all up to the 4th floor. So we've still got the hospital rooms, and we've had to bring in and augment staffing just to be able to meet those needs. In addition to that, we've got 7 patients in our emergency department right now today that need admission, and we're trying to find a place to actually put them, whether it's here at David Grant, out into the community, at another VA hospital, and we haven't found solutions for those patients yet. Why do I bring that up on an individual video appointment? It's because it's really a team sport. How do you manage acute care volume? We have a very large patient population, the 10th largest VA in the country in terms of veterans served, but a very small hospital. So we're always trying to make sure throughput is good. We have places for patients to be. We're getting them in and out quickly. Our nursing home, by the way, today in Martinez has 119 patients of the 120 physical beds that they've got. And so getting people into the nursing home is always an important strategy of sort of offloading acute care. David Grant Medical Center took 12 VA patients from transfer from our ED in the last 24 hours that we've admitted to our partners at David Grant. And so we've got community partners. We're reaching out to the Palo Alto VA, to the San Francisco VA, who took a couple of patients yesterday. Our academic affiliate at UC Davis has taken some patients. We sent somebody to Mercy San Juan today as well. So the care in the community team is working hard. We've got 44 patients in community hospitals today. Our partnerships are working hard. Our nursing home is working hard. Our acute care is working hard. And so everybody's trying to make sure we're managing the scarce resource of acute care beds in the hospital. But there's some other things we can do to make a difference in this regard as well. We just got our SAIL scores. That's the quality measures the VA uses with the star ratings where they compare VA facilities across the country. And there's 2 areas that we didn't score so well in. One was in readmission rates to the hospital. And so the percent of our patients that get readmitted to the hospital 30 days after they've been discharged is higher than what would be expected nationally. Of course, that generates new demand, that fills up a hospital bed, and so managing patients and keeping them healthy once they're out of the hospital, those transitions back to outpatient care, the handoffs from when they first got discharged back to their primary care team or to the specialist that's providing care to them, to their home-based needs, whether it's our non-institutional care program or one of our care in the community partners, is critical to manage readmission rates. The other one that we score poorly in SAIL is admissions for ambulatory care sensitive conditions. So these are things that generally speaking, a patient wouldn't be expected to get admitted to the hospital for, but their primary diagnosis upon arrival is some exacerbation of a condition that normally should be able to be treated in the outpatient setting. So if we're not doing right by our patients in clinic, when we're providing ongoing care, the likelihood that they need a hospital admission goes up if we're not doing a good job with ambulatory care sensitive conditions. So it's a team sport in healthcare. Today is a very difficult and challenging day for us because our acute care volume is so great. But there's so many contributing factors downstream from the acute care day, upstream from before they ever get to the hospital, that all make a difference. And so we're working together to do right by our veterans. It feels a little overwhelming today, and I certainly appreciate all of your efforts in providing high quality care. But we need to be mindful. How do we make sure that we value this scarce resource and do everything we can to treat our veterans right? So hopefully you take all that data, and by the time you're listening to it, it's not July 18, and maybe it's not quite as hectic, but it's still important every day to do right by veterans and to work together to make sure we're providing comprehensive care.